Meanwhile, the Minister of Labour and Productivity, Dr. Chris Ngige, says the federal government will soon respond to the demands and ultimatum for strikes from both the Nigeria Labour Congress and the Trade Union Congress. Dr. Ngige, who spoke via Skype from his office in Abuja this evening, was responding to the Joint Health Sector Workers Union's ongoing strike, now in its fourth day. He told me that it was the government that introduced most of the incentives that have now led to the situation leading to the strike, but contrary to the understanding, the workers now want the incentives to apply across board and at the same levels.
What is going on now is that a lot of the issues that they are bringing to the table now are old issues that occurred in 2009, 2013, 2014. And before COVID or during COVID, we had our first interaction with the union as a proactive measure. This was as a fallout from ministers of labor Minister for Labor in Africa. Joint meeting we held over the COVID. So it was there that the government, like I said, proactively told them that we are going to give them a new hazard and inducement allowance. We are going to give them protective years. We are going to give them group life insurance to secure them so that if anybody suffers fatality and loses his life, his family members not grudge too much. We also even told them we are going to top up the group life insurance and give additional. We also told them that we will also, through the NSITF, Nigeria Social Insurance Fund, give them an insurance for any accident, disability that arises in the course of work for the health workers. So that's it. We now categorize the health workers, and we agree that those that are inside the COVID center, hospitals, COVID clinic, isolation center, will get 70%. Those outside in accident and emergency, in the theater, in the molecular laboratories where these specimens are tested, all 50%. Pharmacists, 50%. Nurses, 50%. Because we did this because you don't know whether the patient that is coming to you in the accident emergency to report is a COVID patient. So there's a risk factor. Same with the nurse who is bringing him or her into the consultant. That was it. And government went ahead to make their budget. And in doing the budget, captured. But that memorandum of understanding said that those people who are in non-public hospitals, doctors and health workers, get only 40%. Those who are doing administrative work inside the hospitals, you get 10% of your salary. So that was how it was worked out. It's not peculiar to Nigeria. Something that prevailed in Ghana, same thing in Addis Ababa, same thing in South Africa. Government budgeted 20 billion. And the 20 billion was for the 3 months of March, April, May, and June. But in between and on the way, when the payment started, government noticed that you have to capture some people that were not even put into account in the original net. So the whole 20 billion was swallowed in 2 months' pay. And government needed now to start searching for money, extra money. President graciously gave an extra 9 billion, 8 billion, sorry, 9 billion. And we had a remnant of about 1 out of the original 20 billion. So that was it. Joensu made the case to the employers, Federal Ministry of Health, that some of their members were not captured and that some of them were underpaid. They made a case for people in the registry. And we looked at it as a committee and we said it's okay. Those shortfalls should be paid. They now started making extra demands to their main ministry. We left them to discuss. They said that their main ministry will now pay them adjustment of Congress salary, which was a matter before the National Industrial Court. They went there with them in 2018. It's still there. They were able to resolve some of the issues, National Industrial Court, and got consent judgment. But on this Congress issue, they couldn't.